gentlemen, good morning, good afternoon, depending on where you are. So we are just starting our webinar. May I ask all the speakers to put on their camera, especially for this opening session? Please, all the panelists, could you please put on your camera? Thank you so much. Thank you so much. So it's my great pleasure to welcome you all today for this webinar on attracting investment from the pharmaceutical sector in Africa. And we are very honored to have participants joining us from across the continent and around the world, representing government, pharmaceutical companies, health professionals, among many other stakeholders. So you are all welcome to this session. So all of us know that Africa stands at a critical juncture with a population projected to double by 2050 and increasing demand for affordable, accessible healthcare. The continent presents a unique and comparing opportunity for pharmaceutical investment. So in this webinar, we will had the opportunity to discuss with different experts. We will have a presentation from UNCTAD, and there will be also a panel discussion. And of course, you will get the opportunity to ask questions and clarifications. But before taking too long, let me invite Mr. Ahmed Benis, the Secretary General from the African Economic Zones Organization, for the opening remarks, and then we will proceed with the program.
Distinguished guests, representative of the African SEZ community, good day. It's my great pleasure to contribute to the dissemination of such an important workpiece, which is the report on attracting pharmaceutical manufacturing to the African SEZ. We see this report as a landmark towards establishing a consistent and resilient SEZ ecosystem, supporting the diversification of regional value chain and promoting sustainable investment. It is in this light that UNCTAD and AEZO joined forces to ensure the promotion of its key insight and recommendation. The objective is to shift the focus and provide practical guidance to policymakers, SEZ authorities, management of companies, and major stakeholders involved in the effective industrialization of our continent. Today's webinar is another milestone in our long-standing partnership with UNCTAD, relevant to our mission in promoting capacity building and sharing best practices across the African SEZ ecosystem. Within our continent, one of the biggest advantages is our youthful and dynamic populations. And in light of the SDG number 3, Health for All, and as zone operator, it is our collective responsibility not only to offer employment opportunity, but also to bolster economic growth that serves to the local communities by encouraging skill set development and innovations in sectors such as pharmaceutical production. The goal is to foster the development of industrial value chain from entry-level raw materials to high added value activities. The growing numbers of African SEZ is also part of this new wave of global industrial value chain and policies that are designed to promote local pharmaceutical production as a generator of wealth, job creation, and medical self-dependence. The survey conducted with UNCTAD has demonstrated that there is an increasing interest in leveraging SEZ policies to support the development of African capacities in these specific sectors. And as of today, only 8 countries account for 85% of the continent's total pharmaceutical manufacturing facilities, making a significant gap of 17% in medicinal needs covered via import. So definitely the SEZ can tap and can tip the scale in favor of local production, effectively cutting down costs and improving quality. However, much is left to be desired in terms of appropriate infrastructures, investments, and workforce. We are convinced that the development of SEZ and the pharmaceutical sector in Africa are intimately connected. An active collaboration between the various stakeholders is definitely required to foster innovative initiatives and contribute to the competitiveness of the African economy zones. This comprehensive report includes many insight and policy recommendations to sustainability, raising local pharmaceutical integrations within the African SEZ ecosystem by attracting investors and encouraging innovations and skill set transfer. So moving forward, the African SEZ must shift their development strategy to align with national health priorities, all while investing in proper infrastructures and know-how necessary to provide more competitive business value propositions for the pharmaceutical sector. To conclude, please allow me to commend the involvement of the UNCTAD team, namely Dr. Richard Baldwin, Dr. Bruno Casella, Mrs. Diane, as well as all AEZO members and partners for their insightful contribution to this wonderful guide. Thank you very much, and I wish you an enriching and constructive discussions.
Thank you so much, Mr. Ahmed Benis, for the opening remarks of our webinar. And thank you for highlighting the strong partnership between UNCTAD and AEZO in promoting special economic zones and specifically in Africa, and also for mentioning the potential the SEZ policy is offering to develop the continental industrial sector. So please allow me to invite my colleague Bruno for the presentation. Bruno, over to you.
Thank you, Diane. Thanks, everybody. It's a great pleasure to be here. It's a great pleasure to reiterate our long-standing collaboration and friendship with AEZO. I want to thank Mr. Ahmed Benis for the nice words and also for supporting this effort to boost pharmaceutical production in Africa through SEZ. And I want to thank the fantastic AEZO team for the support, as always. So my presentation is about this report that we published 1 month ago, 1 month and a half ago, that is attracting pharmaceutical manufacturing to Africa's special economic zones. It's part of the bigger program on investment in pharmaceutical manufacturing that has been going on in UNCTAD for more than a decade, and as you can imagine, it has accelerated after the COVID. And I will try to be short and focus my presentation on 3 points, which are basically on 2 whys and 1 how. So the first why is why investing in pharmaceutical manufacturing in Africa. Second why is why SEZ. Why we had the idea to leverage SEZ to support that kind of investment, and third is the how to make it happen, when we will get to the how, then we will go into the panel discussion that I will have the honor to moderate. And there we will continue the discussion with people and representatives of institutions that are working on the ground to make this happen. So the how will be further developed during the panel discussion. So let's start with the first why investing in pharmaceutical manufacturing in Africa. So the short answer is that there is a very positive alignment, very good alignment of 1, market dynamics, 2, SDG rational, and 3, political support around investing in pharmaceutical manufacturing in Africa. And these 3 components, so market dynamics, SDG foundation, and political support right now are all of them critical to support FDI in any sector. And in pharmaceutical manufacturing in particular, they are very consistent across for Africa. So let's look first, and maybe we go to the first chart, to the market dynamics. On the demand side, it was already mentioned by Diane. It was mentioned also by Hamed. There is a big growing demand for pharmaceutical manufacturing in Africa due to what? Due to population growth. And also within the current population, there is a big too big share of African people that do not have full access to pharmaceuticals. So they still must be covered, and I repeat, they must be covered. So by the WHO statistic, around 50% of population in sub-Saharan Africa does not have full access to medicine. So there is of course a very, very large and growing demand. That's the demand side. On the supply side, there is a major untapped opportunity for local production of pharmaceuticals, because as it was already mentioned, most of the demand that is currently covered is covered by imports. Over 70% of the consumption of pharmaceuticals in Africa is covered by imports. And actually in some categories, and in some countries, this share goes over 95%. So it's basically fully dependent from external supply. And what you see in the chart is the picture of local production in Africa according to one of the latest mapping. It's very difficult to map this, but around 70% of countries in Africa, they have either no local production, that's around half of them, or very limited local production, so meaning less than 5 production plants. On the remaining 30%, around half, they have considerable local production. These are considered to be the regional hubs plus some North African countries. And another half, they have some meaningful local production, but not substantial. So this is the picture. Overall, 70% of African countries, they are not really served by local production. And if we go to the next chart, we see what is the situation with FDI. If local production is underdeveloped in Africa, FDI are even more underdeveloped. So even the limited local production is there in Africa has been mainly generated by domestic producers. So the opportunity is even bigger for FDI to enter the African market. Here you see the statistics of FDI in pharmaceutical manufacturing in the last 2 decades. And so overall, FDI in pharmaceutical manufacturing in Africa has been 5% of total FDI in pharmaceutical manufacturing globally. And that's very small if you consider the size of the African population. And if you look at the absolute numbers, the figures is even more striking, because basically in the last 2 decades we could count only 90 projects in African pharmaceutical manufacturing across all African countries in 2 decades. So that share that needs to grow, and we think that FDI can do much more to stimulate pharmaceutical manufacturing in Africa. But if we go to the next chart, we see something very interesting and actually very, very new. This chart is actually a preview that I'm very happy to share with you from our forthcoming World Investment Report, which will be launched the 19th of June. And what this shows is the trend of FDI in sectors that are connected to sustainable development goals. And it shows the growth rate in the last available year, so between 2022 and 2024. And as you see here, actually health, especially in Africa, is the SDG sector that has been growing more in terms of attracting foreign direct investment, both in Africa and in the group of least developed countries. So there is a big demand. There is limited local production that needs to grow, and the contribution of FDI to this limited local production needs to be bigger. But there is something that is moving there, and maybe we are at the onset of a wave of investment in health, something we have seen some years ago, for example, in renewables, and it's actually taking place. So this is the first why. Why investment in local production in Africa? And this is the market part. Then if we go to the next chart, we see that this investment not only has a strong market rationale right now, but it has a very solid and comprehensive SDG foundation that span across three dimensions. The first dimension of the potential benefit of investing in pharmaceutical manufacturing in Africa is the health dimension, is the SDG 3 that was mentioned in the opening. Local production of pharmaceuticals can improve access to pharma for African people. Can make a contribution to raise that 50% of African people that currently have full access to 100%, which is very much urgently needed. Second element, there is a strategic benefit in addition to the health benefit of boosting local production of pharmaceutical in Africa, because it would help to reduce the dependence from external suppliers. And we have seen that strategic autonomy in pharmaceuticals is extremely critical. We have seen it during the COVID time. We had a very hard lesson at the time of how critical is to have your own indigenous supply of pharmaceuticals, especially in times of health crisis. The third element, we should remember that pharmaceutical is a very important industry. It's an industry that can absorb employment. It's an industry that has a very high technological content. So it can contribute not only to access, not only to strategic autonomy, but to economic growth of the country. So there are three dimensions to which investing in pharmaceutical manufacturing, particularly in Africa, can be beneficial. And then we get to the third element, that is the political support. If you look at most industrial strategy of countries in Africa, you will see that pharmaceutical feature among the top three priority industries. And the same kind of policy priority you will find at regional and at broader multilateral level. So pharmaceutical manufacture, it has a very strong market rationale, it has an SDG foundation, and it has a very strong political support. So that these are the three reasons why it makes sense to invest on that. And we can go to the next chart that opens the second order of consideration, which is why SEZ. And let me say that having a compelling case for investment in pharmaceutical manufacturing, it doesn't mean that the business case of investment in pharmaceutical manufacturing is straightforward or simple. If it had been like this, it would have already happened. But in reality, there is actually a challenging business case for investment in pharmaceutical manufacturing in Africa. And there are some challenges and some barriers that are mainly related to four orders of consideration. One is volumes. Pharmaceutical manufacturing needs volumes to generate and to leverage economies of scale. And in many African countries, those volumes are not there because the market is fragmented, because there is still a lack of a regional dimension. Some countries are too small. Second, it needs integration in global value chains, at least under two dimensions. So one is that realistically, local manufacturing in Africa would still need to source active ingredients, API from outside, because that production at the moment is not there in Africa, neither the condition to put it in place in the short term. Second, because as we said before, local production needs technology. So this transfer of technology needs to be done through the global production networks of multinationals. So the link with multinational, with global value chain is key. Third, it needs a very, very specialized, expensive, and technical infrastructure for storing the medicines, for example, or for managing the toxic waste that this industry can produce. Fourth, it's a highly regulated industry it needs a conducive regulation, an effective way to manage this regulation. So these are the four key barriers. And what we are claiming in the report is that SEZs, at least in principle, are champions in all of these four dimensions, and they can really contribute to address these four barriers. In terms of volume, they are designed to pull productive capacity across the productive value chain, so they can help reach those kinds of volume that are needed to access economies of scale. In terms of link with MNEs, it's in their DNA to be geared towards expert international production and global value chains, and to attract multinational enterprises. In terms of infrastructure, they are designed to provide and to share infrastructure across their sites. And in terms of regulation, it's in their value proposition to facilitate investment and to provide a smoother and more effective management of the regulatory practices. So from this perspective, we think that there is a strong case for SEZ to help and contribute decisively to translate the case for investment in the business case in a sound business case for investing in local pharmaceutical production. And then we go to the next and final part of my presentation, that is about in the next chart. It's about the how to make it happen. Hello, thank you. And here in the report we have outlined 4 key dimensions that we should take into consideration when building a policy package for pharmaceutical investment in SEZ. And these are high level, and they are actually input to the panel discussion that will be following just this presentation. The first element is the business model. We should remember that SEZ are traditionally built for experts, but in the case of pharmaceutical, SEZ should be designed both to fill exports, but also to improve access to medicines at home for the local population. And this requires a regulatory and strategic realignment relative to what is the traditional value proposition of SEZ. So this is the dual business model, as we called it. The dual market orientation is a game changer here. The second is the operational plan. You cannot just build and hope, but you need to plan to the steps to make it happen. And we have identified 3 steps. The first is to assess the strength of the local production environment. For example, there is no point to target the production of active ingredients in some African countries. It makes much more sense to more humbly stick to local formulation and start with that. The second element, the design of the SEZ needs to be tailored to the pharma industry in terms of infrastructure, incentives, and so on. The third element, there is a big difference, and this is something we have illustrated a lot in our reports, between one African countries and the other. So we cannot just think of one model that fits all African countries. The size of the African countries, particularly, is very important. So the design of SEZ needs to be tailored to the specifics of each country. The third point, institutions must talk to each other. So there is the institutional alignment dimension. In the case of pharmaceutical, there are many institutions involved, much more than in other industries. There is health ministries, there is industry ministries, there is trade and investment industries, and then there are SEZs, and then there are investment promotion agencies. So all these institutions, and then there are regional institutions, transnational institutions. So all these institutions need to be aligned, need to sit around the table to design these strategies. And final point, pharmaceutical SEZ should be part of the next gen SEZ. It is something we have, an idea that we have developed a long time also with AEZO. So the idea of the future Z, they needs to be green, they need to be digital, and they need to build, to connect local firm to regional and global value chains. And with this, I conclude my presentation. I dismiss my hat of presenter. I will wear my hat of moderator for the upcoming panel, and I return the word to Diane. Thank you.
Thank you so much, Bruno, for this presentation, which really has very interesting information, especially when it comes to the importance of a special economic zone in promoting investment in the pharmaceutical sector. Thank you for highlighting the need for Africa really to focus on this specific sector, because we are now depending on import at 70%. So that is really a very huge dependency, which creates even issues, especially when we are in the middle of pandemic, like you mentioned, the COVID-19, and that one was a very good reason for African countries. So let us now go into a panel discussion. We have different experts who are going to share their insight, especially in this area of promoting investment in the special economic zones. So over to you, Bruno, for introducing the panelists and inviting each one of them to share their thoughts. Thank you so much.
Yes, thank you, Diane. Thank you to the panelists. We have a very great group of panelists that will help further developing the discussion on how to support investment in pharmaceutical manufacturing in Africa. Just a couple of procedural points. We have 45 minutes. So we have 4 panels. So the idea would be to have around 2 rounds of questions, and potentially, if we have time in the end, followed by a very final flash round of statements by the panelists. So I invite all panelists to stick to a time limit of 5 minutes. I will not be too tough. I will try to avoid intervening, but I will rely on your self management. So let me introduce the four panelists. We have with us Ms. Ghada Abu Zaid, which is coordinator of the African Development Bank Pharmaceutical Program. Then we have Ms. Mary Awuzie, that is the CEO of the Ghana Free Zones Authority. Then we have Mr. Kenneth Chelul, who is the CEO of the SEZ Authority in Kenya. And then we have Mr. Ricardo Jaime Romeo de Carvalho, who is Director of Business Affairs and Development of the Luanda Bengo Special Economic Zones in Angola. Thanks to all. And let me jump to the first round of questions. It will be around lived experience and your national practice. And I would like to start with Ms. Awuzie from Ghana. So my question for you is: Ghana already has some domestic pharma capacity. Ghana was in the set not of the regional champion, but of those countries that have a meaningful domestic local production. In the first chart I was showing you. The question is, what is your Free Zones Authority doing to encourage investment in pharmaceutical manufacturing?
You are muted.
Okay, can you hear me now?
Yes, please.
Yes, we can hear you.
Okay. Good morning, distinguished panelists and ladies and gentlemen. Like you said, my name is Dr. Mary Awuzie. I'm the CEO for Ghana Free Zones Authority. And as an agency, we are under the Ministry of Trade, Agribusiness and Industries. And as an agency, what we are doing to promote pharmaceutical manufacturing companies in Ghana, we are doing a lot. In terms of policy, under this government, we've introduced 24-hour economy plus policy, where manufacturing companies enjoy a lot of tax holidays, where they can import raw materials without paying taxes. Government is also doing very well in terms of financing, helping some of these companies to access financing from the banks. And as regulators of the Ghana Free Zones Authority, what we do more is to provide services that are very, very attractive to companies for them to leverage on. Among these services are hand-holding services. We provide aftercare services for them. And then also as regulators, we are creating an enabling environment for businesses to thrive. And as the Ghana government, the current government, we are very much interested in promoting manufacturing companies, especially in the areas of, let me to pharmaceuticals. Currently, under the Ghana Free Zones under the Free Zones Authority, we have about 6 pharmaceutical manufacturing companies under us. And these companies are enjoying a lot of tax holidays where they import all their machineries for free. And then also they are still enjoying tax holidays. And the most interesting part of it is that they are free to enjoy tax holidays up to 10 years. And after that, they pay only some few taxes, that is from 1% to 15%, up to 15% on their tax, that is the direct, how do you call it? Hello, can you hear me?
Yes, we can hear you.
So they pay up to 1 to 15% on their corporate taxes. So all in all, the Ghana government is doing a lot to support and promote pharmaceutical businesses in Ghana. And as we all know, Ghana and the Free Zones scheme, we are transitioning from the Free Zones scheme concept to the special economic zones. This government is doing very well to pass the bill, hopefully by the end of this year, where companies, manufacturing companies, will enjoy more tax holidays, which the pharmaceuticals companies will also benefit from this competitive tax holidays as well. So I would like to end my answer on the first question here.
Thank you very much, Ms. Auzi. What you have very comprehensively presented, I think, is the engagement of the Ghanaian government and SEZ in supporting local pharmaceutical production, which comes back to what I was saying at the beginning, that there is a major policy momentum for local production of pharmaceutical in Africa, and turning from the national dimension to the more regional one. I would like to now engage Ms. Abu Zaid, because we all know that the African Development Bank is extremely active in supporting pharmaceutical manufacturing, and Ms. Abu Zaid has been one of the pillar of the African program for the African Development Bank. So my question is, what role does the African Development Bank see for special economic zones in particular in advancing its support to the pharmaceutical industry across Africa?
Thank you so much, Bruno. And allow me first of all to thank UNCTAD and the Africa Economic Zones Organization for inviting the African Development Bank make this intervention today. This is a very important and timely dialogue on this very important subject of attracting pharmaceutical manufacturing into Africa's SEZs. And allow me also to congratulate you on the publication of this very important knowledge work. Since you talked about our program, yes, indeed, the African Development Bank has put together a pharmaceutical vision for the continent and carved out actually an action plan for the African Development Bank to develop. It's a 10-year strategy, basically. It all boils into supporting the public sector, the private sector, and both of them to building the right ecosystems to develop local capacities. Now, when it comes to the special economic zones, indeed, as in the case in other vital economic sectors, SEZs can and should actually play a key role in boosting local capacities in the continent, in the pharmaceutical sector. So in terms of the African Development Bank's pharmaceutical strategy 2030, we believe that SEZs could be really a strategic tool and approach to help us to really implement the strategy in an expedited fashion. Our strategy is really calling, as the other partners are calling, for increasing the local capacity up to 60% of essential drugs to be produced within the continent by 2030. And as Bruno, you mentioned in one of your slides, we see the markets are fragmented. We have very little capacities in many countries, and actually the 80% of the capacity is concentrated basically in about 8 countries, right? So we believe that SEZs could really be a strategic solution to address such inherent challenges in the pharmaceutical sector by consolidating the volumes. And you have talked to this very, very eloquently, I think. So here it will address the issue of small fragmented markets. It will resolve the issue of low production or low productive capacity. But it also supports with streamlining the logistic capacities, right? And all of that. I want to mention all of this is important. However, in our strategy, and again, to resolve the issue of fragmented markets, we look at developing capacities not nationally, but actually regionally. So the regional approach to developing the African pharmaceutical market is at the heart of the matter, right? So we believe SEZs could be really a good tool to implement this regionalization aspect of the program. So we know that regional then SEZ hubs could facilitate exports of pharma products across the continent. Because in our program, we really see about 4 hubs, okay, regional hubs. North Africa, you have in East Africa and West Africa and Southern Africa. These are countries that have currently sufficient capacity, sufficient manufacturing capacity, and sufficient logistic capabilities to export their in-house production, but also to act as logistic platforms to re-export products. So, and here, when we talk about these hubs, now SEZs will support the implementation of this regional approach by integrating the small markets and facilitating the regional distribution of pharma products. So aligning the regional aspect to the SEZs, and hence we're talking about regional SEZs here, right? And regional logistic hubs. But let me point 3 areas where SEZs could really support the African Development Bank's strategy to develop the pharmaceutical sector. While, as in other sectors, it is very necessary to provide the basic, SEZ advantages, for these manufacturers or the companies, all the incentives that our sister from Ghana talked about, the well-developed infrastructure, the access to customs, and so on. We believe that such pharmaceutical SEZs should really provide access to national drug authorities, right? And they need to have the speed, they need to have the coordination capacity to expedite approvals of APIs or imported products. Indeed, also the manufacturers would need to have access also to regional regulatory authorities, and later on the AMA, the Africa Medicine Agency, when developed and established and operational. And here the idea is to really see as a benefit or an advantage to link these manufacturers from these regional SEZs to the continental export markets now, right? So the aspect of regulation, regional regulation, and continental harmonization, and all of that has to be at the heart of these regional SEZs. The second point would be, as we know that SEZs now are a key node within the Africa Continental Free Trade Area. So they could be really leverage all the infrastructure networks that our countries are putting in. The DFIs are investing generally in SEZs, putting in the infrastructure, putting in the right logistic tools, and so on. So, and here, just allow me to mention that one of our pillars in our strategy is actually supporting and building, like container terminals, upgrading railways, and improving really custom capacities at borders, supporting CFTA to support really to amplify the pharmaceutical intra-pharmaceutical trade. So we are saying that these are systems that are already existent, but we need to plug in now the pharmaceutical production within these logistic networks, within this infrastructure. Let me here mention that currently there is about 600 million worth of intra-Africa trade in terms of pharmaceuticals, and our plan, and I think also the partners agree that this should at least increase by 70% in the near future, and by 2030 to go up to 1 billion. So the last point is that SEZs, these regional SEZs, could also be an opportunity for effective linkages, much needed linkages between academia and with the industry, right? So they could be really a platform to increase university-industry collaborations, establishing regional centers of excellence, not just a national but a regional, like a consortium of countries coming with donors, and DFIs coming into, and university laboratories, etc., to work on the R&Ds, to work on the trainings, and so on and so forth. So we believe a lot SEZs could offer a lot of advantages for the pharmaceutical sector development at this stage. It's good news that we see that at least I know of 3 or 4 countries that are really active in this area now. First is Egypt, whereby Egypt has just announced about 4 or 5 months ago the establishment of pharmaceutical-focused special economic zone out of Suez Canal economic zone. About 4 million square meters have been earmarked by the government to put in place such SEZ. I know of a number of projects that have been given like land and some incentives already, and we are screening such projects. But also we know of the SEZ in South Africa as well, I know little of that, and I think maybe Bruno can, like this webinar and others would really help us now to go and build the information and the knowledge about what is there, what do they need, what are their challenges, and so on. Ethiopia, of course, had put together something, but again, I don't know much about that. Rwanda is the one in Bugesera, Swiss ACZ is also. You have agglomeration and clustering of several manufacturers and other like research centers and so on. So this is all good news. The need is there, and indeed the ecosystems are existent with a lot of financing and policy work and all of that. And let me leave it here, and then we can discuss more in the next round of questions. Thank you.
Thank you, Ms. Abu Zaid. It was very useful to have this more regional perspective. What I take from your intervention is an integration, actually, of that chart where we show what are the different dimensions where SEZs can help address barriers to African pharmaceutical manufacturing by adding one dimension, which is regional integration, and by highlighting the role of cross-border special economic zones and regional special economic zones that are actually becoming, in general, across industry, more and more popular, and they have a very strong. There is a very strong case for pushing them further. In your intervention, you mentioned the regional hubs, and I believe that one of the regional hubs you had in mind when talking about East Africa was Kenya. Because Kenya has a very strong regional, is a very strong local manufacturing of pharmaceuticals, and it is a hub for the Eastern region. We have worked quite a lot with the Eastern region on a previous project on supporting local pharmaceutical, local production of antibiotics in Eastern Africa, and we have worked quite a lot with Kenya in particular. So now I want to address then my question to Mr. Chelul. Again, Kenya is often mentioned and brought as an example of front runner in local production of pharmaceuticals. So I'm interested to know what are Kenya's strategic plans to position its special economic zones as platform for pharmaceutical investment. So the word to you, Mr. Chelul.
Thank you, Bruno. I want to appreciate UNCTAD and AEZO for this platform, for which we're able to share the various experiences and some of the plans that we may have on the pipeline regarding the sector. Before I say exactly what we are doing, allow me to set the context. I know it's a bit noisy around where I am. We are in the middle of some meetings, but you'll bear with me. So first, as you're aware, as you rightly said, Kenya has a long history of pharmaceutical manufacturing. Actually, outside of SEZ, they have already well-established industries on pharmaceutical manufacturing, limited to some few technologies, I must say, not across board. And in support of that, also the government has been trying to reform and create the necessary enabling environment. In the current dispensation, Kenya government political system exercise something called devolved unit. So technically, we've got a national government and 47 small governments. All of them have capacity to procure. Moving on from procuring, the current government has initiated universal health care, which means every single citizen in this country now is entitled to an insurance cover by the national government, contribution for which are made for those who are engaged in meaningful employment. We also have private sector, and in particular faith-based hospitals that have a system of procuring. So national government procures through a central procurement system called KEMSA, while faith-based do through a similar arrangement that covers only faith-based institutions. All this means there is the right environment for uptake of what is produced. So SEZ is only one of the means to encourage increased production outside of the normal pharmaceutical sector. Already in our sister institution, which is export processing zone, there are up to around 7 to 10 pharmaceutical companies who primarily produce for export. In our special economic zone, which is a fairly recent program, already we've licensed, I think, 3 or 4, and there are a few on the pipeline. So what are we doing as an SEZ? Already in the last 2 years, there have been 1 economic zone that has been gazetted purposely for pharmaceutical production. There are other zones out of the 45 we've gazetted that have mixed use arrangement where an industrial park also contains SEZ. And that is ongoing. People are coming in. But there is something we witness, which is very interesting. There is a lot of interest by local pharmaceutical associations and chamber of commerces, for example. These professionals have realized that on their own, they cannot set up pharmaceuticals. So what they've decided to do is to come up, and the idea is to create an environment, a cluster, where they're able to share certain infrastructure together. For example, ETP, be it sterilization and all those. That we've witnessed, and one of those have actually approached us for a possible offer of licenses for such groups. The other thing that go with SEZ infrastructure, licensing arrangement in Kenya is that we also offer a license for a science park, a scheme. These then allow knowledge-based institution, research-based institution to be able to undertake research, take advantage of the schemes we offer, and we think this could lead to innovation, patents, and all those, and especially R&D. So we actively encouraging that. As an SEZ authority, of course, we are also trying to build on the various successes. Already, our national grid is considered very green by the fact that our sources of energy is 93% renewable. So we adapt our zones as green manufacturing. Therefore, we are actively trying to set up with partnership with UNIDO, IFC, template for ESG compliant, so that when you come to a zone, we actively encourage you to be ESG compliant for purposes of obviously being compliant to SDG, for example, and as a platform to market yourself. So by and large, there are various things that are going on around Kenyan SEZ. Being new, the entry, we have I think a list of around 4 to 5 SEZ, potential SEZ companies that are actively seeking license from us. And there are 1 or 2, around 9 SEZs in Kenya that are run by government. And in those ones, we are actively clustering so that we don't have to have pharmaceuticals everywhere. We cluster for purposes of infrastructure, for purposes of sharing knowledge. And in particular, as an authority, we are keen on a cluster where there are APIs, technology such as APIs, final people who are doing manufacturing, so that it's kind of a value chain. They relate to each other, they are able to share experience. That's where we are. Some of these are in the formative stages, but we have a private sector that's very keen, that's well mature. All they are doing now is how do we take advantage of what is available, this being locally and internationally. On the financing side of things, Kenya government has set up a company called Kenya Development Corporation that offers a de-risking mechanism. So if you have a local entrepreneur who wish to engage in pharmaceutical, they can get a credit line on a single digit figure to invest and given moratorium period for which they can build their facility and start repaying loan at a comfortable rate over a period of time. So quite a number of things, still a bit noisy, but at least we are moving somewhere. Thank you.
Thank you very much, Mr. Chelul. I think that the experience of Kenya, which is one of those that I know more closely because I've worked with the country, is particularly interesting because you can correct me at the next round if I'm wrong, but I mean, it has a very strong local manufacturing industry relative to African benchmark. But it has been traditionally made mostly by domestic players with not such big involvement by multinational enterprises. So I'm curious, but again, we keep it for the, maybe if you can just follow up quickly in the next round. I'm curious to know whether this pushing pharmaceutical manufacturing now through SEZ has increased the link, which seems to me the case with multinational enterprises as well, and has opened new opportunities for good synergies between the strong local players and international players that manage the pharmaceutical global value chains. So that's one question that I had in the back of my mind for you later. And then I would like to finish this first round of questions with Luanda Bengo Special Economic Zone and with Mr. De Carvalho. Luanda Bengo Special Economic Zone have several pharmaceutical manufacturer, and as we have seen from the statistics before, from the numbers before, this is not so common. So we would like to take the opportunity to hear their experience, and I would like in particular to ask to Mr. De Carvalho if he can share a practical example or lesson from the experience of Luanda Bengo that shows how special economic zones can help address infrastructure or, for example, regulatory challenges related to pharma manufacturing.
Bruno, thank you very much for the introduction. Just want to make sure you can hear me well.
Yeah, perfectly.
Okay, that's great. Number one, first I'd like to thank AEZO and especially UNCTAD for this invitation. It's a pleasure for us to be sharing a bit of our insights on how this pharmaceutical industry is being tackled here in Angola, specifically in the Luanda Bengo Special Economic Zone. Just to kind of give a bit of context on what we are, who we are, the Luanda Bengo SEZ is a government entity that was created in 2009, and we have over 200 companies currently installed in our zone, and of which about 80 are operational. So we have about 80 factories who are currently functioning and produce every day to supply the local market of Angola and also the regional markets, as well as international markets, because some of our companies export. Looking at our experience when it comes to the pharmaceutical sector, and bear in mind, I mean, one of the tough parts of being the last one to speak is that many of my colleagues already gave a lot of the key insights, right? And our experience will not be very different to those already shared. but will be specific pertaining to what we have here in our zone. So when you look at our pharma situation, within the Luanda-Bengu Special Economic Zone, we currently have one fully functional factory operating in the pharma sector, but in terms of curious perspective, these past 2 years we've actually been getting a lot of requests for pharma companies to come in, because we've been doing some key strategic reforms inside our zone to make it more attractive. So currently we have 7 pharmaceutical companies in the implementation phase. 2 weeks ago, we inaugurated one of the latest ones. They're in implementation phase, and they will be producing tablets and IV fluids. And how do we as the SEZ help overcome infrastructure or regulatory hurdles when it comes to the pharmaceutical manufacturing to make sure that we can track? So number one, Bruno, to touch on this prolific discussion, is we have to identify the critical bottlenecks, right? At the Luanda-Bengu Special Economic Zone, we recognize that the pharmaceutical production requires strict infrastructure standards, right? So you need to focus on the adequate supply of water, adequate supply of electricity, and of course you have to have systems to foment a very thorough waste management regime. So here in the Luanda-Bengu SEZ, we have the capacity to pump 3,800 cubic meters of water. We have 2 substations, power plants on site, with a conjoined capacity of 136 MVAs. We have also a wastewater treatment facility on site. So we do have all of these small but critical components when it comes to guaranteeing that the pharma sector has the adequate conditions for them to be able to implement their business, and also to be able to have a successful, sustainable environment to develop. And also, other than identifying the critical bottlenecks, you also have to develop the tailored infrastructure, right? When we say tailored infrastructure, we have to make sure that you have dedicated utility corridors that are actually meeting the good manufacturing practices requirements, right? So we have to make sure that we're meeting the GMP requirements, to make sure that we can create an environment that is as reliable as it is appealing for the investors, especially in the pharma sector, to come and implement their projects, right? And other than that, of course, you cannot look at the critical bottlenecks as well as the tailored infrastructure approach without you looking also at the regulatory facilitation that the Special Economic Zone offers. And when it comes to ourselves, the Luanda-Bengu Special Economic Zones, we have a one-stop shop mechanism that is implemented in the zone that is supposed to help and assist investors when they come to set up their companies, as well as take care of certifications, licenses, import and export approvals. And the main objective is to reduce the bureaucratic hurdles and delays, so that we can guarantee an efficient environment for business to be done. And also, when it comes to the regulatory facilitation, you also have to look at the institutional alignment. When we say institutional alignment, we are referring to how we as the Luanda-Bengu Special Economic Zone are aligned with, number one, the government stakeholders. So we're talking about the Ministry of Health, we're talking about the Ministry of Industry and Commerce because of the export-import situation. And that being said, because we are indeed a government government entity, right, we do have direct alignment with these governing bodies. I mean, 2 weeks ago, when we inaugurated a factory called Terra Pharmaceutical, the Minister of Health herself was here at the inauguration. I mean, we had the chair of the Angola Sovereign Wealth Fund. We had, of course, our chairman of the Luanda-Bengu Special Economic Zone. So we do have that institutional alignment that makes sure that the companies that come to install themselves in the Luanda-Bengu SEZ can benefit from certain conditions that make it even more competitive for them to be here. And when you look at the environment that we can create, we have over 4,700 hectares of land in our main reserve, which is where I'm currently sitting right now. This reserve is located less than 10 minutes away from the new international airport of Angola, which is slated to be one of the top 10 migratory density intensive airports in Africa, right? So we share actually a border, a more than 30-kilometer border with the new international airport. And curiously, the new airport used to be a part of our reserve, right? So the government literally carved out a small portion to sufficiently provide for the new airport due to the strategic infrastructures that we have at our disposal. So we have here a whole ecosystem that makes sure that we can create conditions to overcome any type of barrier or hurdles that pharmaceutical manufacturers can face. For example, we have a dry port on site. We have more than 12 logistic warehouses of 30,000 square meters each, right? So you look at that, and then you look at the proximity to the new airport, and as well as all the key logistic players of Angola are all have a presence in our zone. So when you look at what we have created in alignment with what my colleague from Kenya was speaking about regarding the creation of clusters and the boosting of value chains, this is something that we have tried to tackle strategically to make sure that we have here a fully codependent environment that makes it a good condition for business to thrive. And this approach has allowed us today to be able to say that we have faced over 194 million US dollars of total investment for the pharmaceutical projects that are coming into our zone. So considering the one project that's already fully functioning and the other 7 that I've mentioned that are in the implementation phase, we're talking about over 194 million dollars of investment. And this permits us to, just by the pharma sector, create about 900 total new jobs, right? So that being direct and indirect. And of those, all these projects that are currently ongoing in our zone, we are estimating an installed IV fluid capacity of production for about 20 million liters per year. Like we're estimating a packaging capacity of about 60,000 units per day. We're estimating a syringe production capacity of about 30,000 units per day also. So these are like, and bear in mind, this is the numbers that we are estimating once all of these factories are fully operational. And so Angola is actively taking a position, especially because of our footprint in the SADC region, right? We're taking an active position to try and to assist in the overall integration and penetration of the pharma market within the region, to make sure that we can assist in guaranteeing a sustainable environment for all of our populations.
Thank you. Thank you, Mr. Carvalho. While listening to you, I was thinking it would be interesting to integrate our report that outlines a kind of strategic view on this issue of SEZ and pharma, with some case examples that goes into the actual challenges and issues and operational steps on the ground. And I think that Luanda Bengo could be a very good source of.
We'd be more than happy to be a part
of case examples. Okay, thank you to the panelists for the first round of intervention. So we will go with the second. That will be more focusing on collaboration and enabler. So on the institutional settings, we have understood from the first round of interventions that the things like regional coordination and coordination with health authorities internally, and these are all extremely important things. So the idea is to focus on that. I will again reiterate my invite to the panelists, if you can, to stick to 5 minutes. If we all stick to 5 minutes, then we have half an hour for the Q&A session. I know that there are already many questions that participants have raised, so it would be nice to be able to answer as many of them as possible. So I will follow the same order. So I will start my second round with Ms. Abuzi from Ghana again. And my question for you, Ms. Abuzi, is what role can SEZ play in linking domestic pharmaceutical producers with export market, and again, talking about that regional value chains. Thank you.
Bruno, I think Dr. Awusi is not available. Maybe we can move on to Dr. Kenneth first. While she joins us again.
Yes, of course we can, sure.
Thank you.
So we move to Kenya. We move from West Africa to East Africa. So again, my question is, what role can Kenya play as a regional hub? We know that it is.
I'm here.
Mr. Awusi is
I'm having network issues.
So I'm happy to.
Yes, I'm here.
Would you like me to repeat my questions, or did you hear it?
Can you repeat it for me, please?
Yes, of course. So my question is focusing on collaborations and enabler, especially at the regional level. And the question is, what role can SEZ play in linking domestic pharmaceutical producers with export markets, and in particular with regional value chains?
Okay. Talking about roles, I think from the regional levels, we can use AFTA and ECOWAS markets. SEZs can serve as launchpads for Ghanaian pharmaceutical firms to access continental markets under the AFTA and the ECOWAS trade liberalization scheme. Again, by supporting export-oriented production that complies with regional standards and easing cross-border trade through customs facilitation and trade diplomacy. An example of that is that SEZ-based producers can benefit from zero tariff access to over 50 AFTA countries if their products meet the rules of the region. Again, we have to support regulatory and harmonize and certification. And the role SEZ can play is that SEZs can integrate regulatory compliance services to enable faster entry into regional markets. And how are we going to do that? The question will be how. It is by hosting FDA-backed testing labs, promoting adherence to World Health GMP standards, and facilitating certification under the African Medicines Regulatory Harmonization initiatives. And the benefit of this will be enormous. And the third point I want to talk about is clustering and integration into regional value chains. The role SEZ can play is to provide platforms for pharmaceutical clustering, bringing together API producers, formulation manufacturers, packaging supplies, and logistics providers. And one may ask how. It can be done through shared infrastructure, public-private partnerships, and incentives that promote vertical and horizontal linkages. An example of that is a domestic firm could partner with a West African distributor or package generic medicines for another country's brand within the SEZs. And the last point I would like to talk about would be attraction of the strategic FDI for value chain development. And with this, the role SEZ can play is to attract foreign pharmaceutical companies that can partner with or subcontract local firms. And we can do that by offering competitive incentives and market access. Special economic zones can attract API manufacturers, R&D hubs, and multinationals that can source inputs or license production to Ghanaian companies. And the benefit will be, once again, enormous. This will boost local capacity while embedding domestic firms into multinational supply chains. Last but not the least, facilitation of export logistics and trade infrastructure. And the role the SEZ can play is to reduce transport and trade costs through integrated logistics services and proximity to ports. And it can be done, SEZ like this, how do you call it? Those near Tema Port, example, that's the example I'm giving from Ghana, for example. SEZs like those near Tema Port or new inland logistics hubs can house cold chain storage, customs clearance facilitations, and bonded warehousing. And this will enable reliable and cost-effective export of temperature-sensitive pharmaceutical products. And access to trade finance and investment services, the SEZ authorities can partner with development banks and trade finance institutions to offer export credits, insurance, and investment guarantees. And this can be done through collaboration with institutions like AFRI-EXIM Bank, EXIM Bank of Ghana, and the African Development Bank. To conclude, I would say the special economic zones concept, once again, Ghana is transitioning from the free zones concept. And with all these rules, we will do better when the bill is passed, hopefully, like I said earlier, by the end of this year. And the special economic zones will play a major role to boost Ghana's industrialization as well as African industrialization as a whole. I will end here.
Thank you very much, Ms. Awuzie. And thank you for also raising the theme of the UNCTAD. That's a big game changer across the African continent, and including in pharmaceuticals. I believe we will have also an interventions later on about that. So let me go to the second panelist. I will jump to again from West Africa to East Africa to Kenya to Mr. Chelul, because I believe he needs to leave us soon. So I'm keen to hear Kenyan perspective on this. So the question is similar. So what role can Kenya play as a regional hub? It is de facto already a regional hub for pharmaceutical manufacturing. And how are you actually actively promoting regional cooperation and value chain integration through special economic zones?
Okay, thank you, Bruno. And I want to start by, there is a question you asked me after my presentation. You are absolutely right. The local production of pharmaceutical in Kenya is dominated by local farms. Actually, there are not many multinational. But I want to give you an observation we've seen lately. There are sensitive pharmaceuticals, such as the vaccines, that require additional infrastructure, such as sterilization, using gamma, using e-beams and all those. What we've observed lately is that multinational are going towards a direction where Kenyan dominated firms are not present. And in particular, I'm seeing a lot of movement towards medical devices than pharma. Already, we have one of the listed Chinese company in one of our zone, and they are in the process of winding up their production facility in China to relocate to Kenya to be there. So they'll have a kind of series of factories where one factory is an input into another. We witnessed that. Only yesterday, Kenya government and Chinese government has signed a $500 million to invest in vaccine and non-pharma. 2 years ago, leading to last year, we had Moderna negotiating with Kenya government to set up their facility for their vaccine. And there were a lot of discussion, including amending some of our laws to accommodate firms such as Moderna, who are keen on protection of royalties. So we've had a negotiation on how can they be supported in terms of withholding tax to invest in Kenya, so that they can also benefit in the process of investment. So there's a lot happening in terms of traditional areas of medicine. towards the more emerging, the vaccine and medical devices. That I can tell you there's a lot going on. Now, in particular, what Kenya is doing, and I'm happy with what Mary presented. I think she has said many of the things I would have said, but I want to add the following. I think from our experience here, everything almost boils down to market access. And alongside market access, you're talking about certification, meeting the necessary quality quality issues, standards. What I see is the need for countries such as Kenya and those we are partnering with, and also especially when we have ACFTA, COMESA, EAC trading blocks coming on board, we need to have MRAs between government, mutual recognition agreements, so that product produced from one region or one country can be recognized by another, therefore making it easy for firms participating to access the respective market. I know that has been a challenge. Usually, when in market access, we talk about we want medicine that have CE mark equivalent, that have FDA approval. I think there is need for an African discussion on similar arrangement. Could we say we have a medicine or a pharmaceutical with Kenya Bureau of Standards equivalent, can be easily accepted in other countries, something like that. But to me, ACFTA and such trading agreements provide the huge opportunity, and there is need for governments to see how we can begin rolling this. More so now that under the rules of origin, goods emanating from the zones have been recognizing as emanating from various parts of African countries. In Kenya, and I know this normally what normally happens in Kenya also translates to what's happening in the East African region. As you are aware, East Africa operate under one custom law. So whatever is acceptable in Kenya will be acceptable in Uganda and the rest of the 8 countries. So custom laws need to be harmonized. If there is need some people to be given preferential treatment by virtue of their level of production, is done within this. This then allow for wider consumption of goods emanating from one country to another, and preferential treatment for those that need to be accelerated. Kenya has been, in terms of development of laws, I know particularly with the experience of special economic zone laws, we've been championing certain laws to be put in the region, and I know it's happening in pharmaceuticals. Kenya, as a country, encourages a policy called local content. When Kenyan hospitals purchase products, certain percentage is dedicated to locally produced goods.
Hello, I think we have lost the connection.
Or a pillar towards. Sorry, I think I'm using my phone. Somebody called me. I hope it's okay now.
Yeah, it's okay.
Is that okay?
Yeah.
So I was saying, so there are issues such as local content. Of course, that goes against the regional integration. But what it does is that it can encourage local production. And then as you go local production, it allows you to expand. Because if you can't meet the local, it will be difficult to meet the export. One of the other things that I believe platforms such as SEZ needs to provide for, and we are already in discussion, is doing common manufacturing facilities or common user facilities. If Uganda can, for example, put up a facility for irradiation, these are very expensive infrastructure to be put up, then there is no need for the other region. We can have comparative advantage. A country A to do certain specialty where it can be shared with the rest. Packaging materials and all those things. To me, this is the way to go, because then it allows people to have specialty. If one country is an API producer, it can feed into the other country's final production. Otherwise, most of the other things shared by Mary were, to me, in line. I know I participated in a World Bank funded project a few years ago where World Bank was supporting academic centers of excellence in various fields. And it was meant to be a regional center of excellence. I'm aware that Rwanda was actually chosen as a center of excellence in medicine and medicine related. I think these are the kind of things that we need to build on. Now that bodies such as the World Bank are facilitating, then we could develop similar in various other sectors. SEZ laws for Kenya applies to Uganda, and we are all the same. So I still believe that a regional approach to what we do, whether in setting up regulation, help to minimize. If we can extend that to Africa-wide, so that in future, because otherwise we cannot continue racing down to the bottom in terms of lowering our taxes. And then at some point, this thing may fail. I normally call it the race to the bottom. We really need to have a common ground across Africa, so that what we are taking advantage of is there are raw materials that one country has an advantage of that we can now use as a center of excellence, as opposed to having it available across the continent. That's my presentation, Bruno. I hope it does make a difference to the experience we are having.
It makes a difference, and it actually touches upon a couple of things that were not raised before. I fully agree on the race to the bottom. It's not. It can be effective, but it's not sustainable in the long term. There are things, by the way, like the international tax reforms that are somehow also introducing increasing barriers to this kind of fiscal incentives. You mentioned two things. One is regulatory harmonization, that is very important. And the other one is what we called in another report that we published a couple of months ago, together with this SEZ report that is called Building the Case for Investing in Local Production in Africa, market shaping incentive. When you mention the local content, those kind of incentives that governments can provide because they are part of the deal. And that is a very specific feature of pharma. And they are controversial somehow, but they can be very effective if properly used. So thanks for introducing these other two important elements in the big picture of building the case for investment in local production. And let me just now pass to the African Development Bank, to Ms. Abu Zaid, and to hear how she sees the role of the bank and other partners in supporting the long-term viability and integration of Pharmazone into regional and continental value chains. You already touched on this in your first intervention. If you can briefly expand on that, thanks.
Yeah, thank you so much, Bruno. And just allow me to mention that you're absolutely right. I mean, like, you could use the experience in Kenya, Ghana, and Angola, right? To have like some case studies from the continent, basically, because the colleagues have shared really very rich inputs, and all of us will benefit from that. And if possible, if we can have really like their contact details, because as the bank is in the mode of building business, like in the pharmaceutical sector. So it will be really very interesting for us to see what these SEZs in these particular countries are doing, what are the, where are the gaps, and so on and so forth. Also, we would like to know the capacity of the companies operating in these SEZs. But also on the idea of, by the way, the centers of excellence, it is the AFDB who have, by the way, very recently supported Rwanda by actually supporting Rwanda achieve ML3, the NRA of Rwanda. we extended a grant, and this is one of our tools that we extend to national regulatory authorities, even the REX. We supported recently ECOWAS and also COMESA to support the idea of improving standards, but also the harmonization of the standards. So we are very active in that area at the national level, at the regional level, but also currently the bank is working together with AUC, and we have an ongoing project that we're designing to support the operationalization of the AMA. This is from the AFDB. Now, just to expand on what we were talking about earlier, now the bank's plan is really to support expanding the local production. And as we said, now the SEZs, we're looking at it as a tool, basically. But let me talk about what the bank is doing at the heart of its strategy in implementing that strategy. The bank is earmarking about $100 million yearly to support the manufacturers to expand capacities on generics, on APIs. We're talking about national players. We're talking about regional players, but also we're talking about international companies who would like to invest in the continent. And we have been relatively successful so far with about 3 to 4 projects that have been approved, and we have got a good pipeline basically from, and these projects are from different areas in the continent. So we are not really concentrated in one area. We look at where the capacity is, and we get in there with partners, and we try to boost that capacity. But we also support the ecosystem, like I mentioned, and I just alluded to some of our work in improving regulatory standards, harmonization at the different levels, national, regional, and continental. When it comes to SEZs, I think as there is a lot happening in the countries, I mean, at the country level in terms of building capacities there and some achievements there, the bank and other players are also very active in the area of building or creating SEZs that are effective. And it's been done for, of course, other sectors. And when we talk now about applying that for the pharmaceutical sector or implanting now pharmaceutical companies in some of the SEZs, I think the experience is there, and we need to learn from what is there. The bank is already an equity investor and an infrastructure financier for SEZs. Recently, the bank got into RISE integrated international industrial platforms through equity investment. So the bank goes in there in such big PPPs as an equity investor or even an infrastructure financier. We also have a lot of experience being like a knowledge and capacity, knowledge provider and capacity builder, basically, when it comes to ACZ's policies, design, implementation, and so on. So the bank rolls out regular workshops in the area. We extend grants to support SEZ, national or regional SEZ authorities to develop capacities, technical assistance, put in studies, and so on. We also see ourselves as a PPP enabler, and I think this is important here because the bank uses several tools, financing tools like the debts, like the grants and all of that, but very important for SEZs to succeed would be partial risk guarantees, credit risk guarantees, and this is to reduce the risk profile of such mega projects that are in partnership with the government, where the government at times is your off-taker. So we have experience there as well. And also recently we went into supporting green and sustainable industrial programs So we finance eco-friendly SEZ models that we believe could incorporate renewable energy, efficient logistics, and the appropriate environmental safeguards. So there is a whole system out there. There is a lot of capacity. There is a lot of experience that have been expended in other sectors. We need to know, I think, work together to see where are the low-hanging fruits. If there are, some colleagues have written in the chat box that in Ethiopia, for instance, the SEZ concerned with pharmaceuticals, there is more than maybe, I don't know, 8 or 10 companies. So it's really important to know where are they, what do they produce, together, and financing needs, basically. Any form of offtake by the government, for instance, for these consortia, if you will, of companies. And let me just evoke here just one example from Egypt. Egypt recently, and some of you may know that they have created EVMA, which is the Egyptian Vaccine Manufacturing Alliance. So it's not this is not an infrastructure, it's not like a physical space, but it is an alliance made up of about 5 major vaccine producing Egyptian companies. So the idea there is exactly these issues, Bruno, that we have been, everybody here knows in the pharma sector, we're talking about where the demand, we're talking about the market shaping, where is the market, we're talking about the offtake. When we look at screen projects, we want to see commercial viability, we want to see offtake, we want to see where are you going to sell this nationally or regionally, or so what's happened there is that the EVMA, under the umbrella of Egypt's unified procurement agency, under the umbrella of the Ministry of Health, are putting together these companies as the front line, like the consortium that will be developing in collaboration vaccines, not in competition, right? They will be developing the vaccines for the domestic market, but also, for the export market. The idea is there is a lot of collaboration, coordination happening there in terms of what we're going to produce and the volumes of the production. Secondly, it's also about the government will be the first buyer, right, from this alliance, right? So here the market is there. But also the government is trying to, of course, they reach ML3 and they are doing a lot of harmonization with many drug authorities, and hence now they are opening markets, like opening markets, export markets. So the countries or the companies are not doing that by themselves. It is an alliance. It is done together under the umbrella of the government. So I think these are the sort of also initiatives that if you have the infrastructure of an SEZ and it has the needed logistics and everything, but you have the coordination and we know the volume is coming from where and where will be the market, and everybody here knows their role, namely the government, the drug authorities, the companies. Things will really work very nicely. Let me leave it there. I'm ready to answer any questions.
Thank you very much. Thank you very much. So we have the last question for the panelists, and I will ask Mr. Carvalho to be as short as possible to allow then for the time for the Q&A, and this is to look more at the national kind of collaboration. What do you think should be the priority areas of collaboration between SEZ authorities and national health and industrial agencies? Please, I know you can be very sharp as possible. Thank you very much.
Bruno, thank you very much. I will do my best to keep it as short, sweet, and simple. Pertaining to your question, I think much of the fellow panelists here have already touched upon many of the areas of which CZ authorities and national health and industrial development regulatory bodies must collaborate on. I think the most important one and the number one has to be the regulatory alignment, right? I mean, we have to ensure that the pharmaceutical investments in special economic zones are supported by clear fast tracking and clear fast track regulatory procedures, right? Especially when it comes to licensing. Like, we have to get the investors on board with all the conditions created via the SEZ authority, and that spans out to the governing bodies authorities when it comes to the medical licensing and all of that. And of course, the good manufacturing practices certifications, as well as as adequate product registration. I believe with these key small issues walking hand in hand, we can sufficiently provide a decent regulatory alignment when it comes to having the SEZ authority advocate for the investor and the manufacturers to represent their interests when it comes to getting the government and the relevant bodies to support such strategic initiatives that will not only impact our individual nations, but will also foment big prosperity and diversification and the development of Africa as a whole. Another key priority in my perspective will have to be strategic planning and policy coordination, right? I think jointly all bodies must identify pharmaceutical products that align with the national health priorities. For example, the essential medicines, whether it be malaria, whether it be influenza, and so on. I think that we should all come hand in hand to make sure that as the SEZ authorities, we are the ones, when we're sitting with the investors, that we tell them, listen, our country needs this, the market needs this. And I think that makes it easier, because if we are aligned with the government's health agenda, then I think it makes it easier to get what I mentioned before as the number one priority, which is the regulatory alignment necessary to foment industrial capabilities and co-developing of a structured incentive framework to support the production, right? Because I feel like that the authorities will only give key incentives to the relevant investors if they are aligned with what the country needs. And also, another critical area of collaboration has to be the workforce development and the research and development support. I mean, special economic zones play a pivotal role when it comes to fostering macroeconomic sustainability and development, right? We're talking about having the capacity of integrating local workforce into industrial production, into industrial output, into macroeconomic development, right? So you need to align ourselves with the key bodies to make sure that we have the right academic research centers on board, that we have the right governing institutions on board, so that we're able to, when it comes to pharma, coordinate with the ministries of education as well as Ministry of Health and the Ministry of Industry and Commerce to create training programs fostered by the SEZ authority that will meet the pharma sector needs and promote innovation through joint research initiatives as well as technology transfer. I feel like this is one of the most underestimated necessities that is needed in order to create an environment in which pharma can thrive in the African continent. And also, just to close this small idea, I feel like this integrated approach will ensure that the SEZ serve not just as industrial hubs, but as catalysts for sustainable and strategic pharmaceutical ecosystems in Africa. And aligning a bit to what my colleague from Kenya said, this is how we can then start to target the creation of clusters and the promotion of value chains in the pharma sector.
Thank you very much. Thank you very much, Mr. Carvalho. You have been very helpful in summarizing briefly all the points, and so we can. So I thank all the panelists. I think what's clear from your intervention is that yeah, you agree with us that the investment, the case for investment in local pharmaceutical production is there. Is compelling from several points of view, from a market perspective, from a SDG perspective, from a policy perspective, and that SEZ can be important tools to support that. So with that in mind, I will pass the word to my colleague Diane to transit, to shift to the Q&A session, where we will take the questions from the participants. I will ask the panelists to stay perhaps a bit longer than the sharp 2 hours, to be able to answer some of the questions that were raised. Thank you very much.
Thank you so much, Bruno, for moderating this interesting panel. We are running out of time, so let us try very quickly to go through the questions. Hiba, could you please help us to go through the questions very quickly? And I would like to ask all the panelists to just use 1 minute to respond to those questions. So over to you, Hiba.
Thank you so much, Diane. Hello, everyone. Welcome. So quickly, we have 3 questions that we would like to address to all of the panelists, including Bruno, of course. The first one is regarding building regional value chains in Africa. And the question is as follows: how to use African SEZs to build a regional value chain in pharmaceutical sector and other strategic sectors? So let me repeat that a second time. How to use African SEZs to build a regional value chain in pharmaceutical and other strategic sectors. The floor is yours, dear panelists, and you can go ahead and answer the question at your leisure.
Maybe I can give it a try, which is actually not my answer, but it's a summary of the various interventions from the panel. So it's a collective answer, if I may be the one. Well, the SEZ by their nature are cross-border entities, and Ms. Abu Zaid, for example, was mentioning cross-border SEZ. So those SEZs that are designed to facilitate regional integration and regional value chain. So I would say that SEZ are by design already geared towards regional coordination and regional integration.
Well said, Bruno. Thank you. I think that sums up really the essence of today's webinar. Would any of the other esteemed panelists like to take the floor, maybe add something before we move on to the next question? Ricardo, Rada, Dr. Awusi, Dr. Kenneth, the floor is yours.
Allow me just to jump in to follow through on what Bruno just mentioned. I think Bruno touched on it perfectly, right? Everything that we have discussed in some way, shape, or form are catalysts for making sure that we potentialize the regional value chain in the pharma sector, right? But we also have to look at more in depth into interconnectivity, right? And cross-border SEZs is something that it was spoken about, and I feel like it's also a strategic way forward, but also is the way in which existing SEZs that are trying to pioneer this specific sector in their own regions also collaborate amongst each other. Because, for example, perhaps the companies that I have here in the Luanda Bengu Special Economic Zone in Angola may have also an interest in exploring the market in Kenya or the market in Ghana or wherever. But if our institutions, right, as SEZ authorities, do not have a strong bridge between us, it will be very hard for us to create this link between the factories that are already here. Because for example, the majority of the investments that we are getting in the pharma sector are non-local players. We're talking about investments from the United Arab Emirates. We're talking about investment from China, from India. And these international powerhouses, when they come to a specific country in Africa, they're not only looking at the national market, they are looking at how they can also tap into the mechanisms that are thriving around them in the ecosystem that they install to also spread out and to tackle the regional market, right? So this is the term regional value chain. We have to tackle the regional market, right? So if we collaborate amongst each other via also initiatives such as this brilliant initiative that UNCTAD and AEZO are putting together and having us speak I mean, I've learned a lot of things from special economic zone, fellow special economic zones that I didn't know. And so this is something that will also help me to think on how we can try and come together to create mutual opportunities.
Iba, if I may add just one thing that was just inspired by this, of course, this case for regional integration, and coordination, it increases the role of organization like yours, like the African Economic Zone Organization. I mean, this is what we are doing right now, no? This is regional coordination, right? So I think you have a very promising and challenging path ahead for organization like AEZO.
Bruno, this is Kenneth from SEZ Kenya.
Go ahead, Dr. Kenneth.
Okay. Now, I want to use practical living examples that we already know in other sectors of the economy. And I want to quote the case of infrastructure development around the railways and the roads in Kenya and the region. So what East African countries have done, there is a road called Lapset in Kenya, starting from Lamu, going to Ethiopia and Southern Sudan. So the three countries have sat together and agreed, this is how we are going to do, this is the contribution of each country. I believe that and this is a personal belief based on my experience, as we set up the infrastructure for pharmaceuticals, we need to have the markets in mind. Because if we are setting up an SEZ for local market, then it will take a lot of effort later on when the business does well and you need to expand into the region, then you need to also to expand the infrastructure. But at the regional level, particularly using the trade agreements like ESC, Commerce and all those, countries should be coming up together saying, as we put up this is how we are all going to work together with a view to supply pharmaceuticals to the region, Africa and beyond. I think that way it makes it easy to face development of infrastructure over a period of time, attracting the relevant huge MNCs to come into our zone, knowing that as they put up their facilities, they have specific regions catered for, whether in terms of infrastructure or even market access decisions. That's how I see it.
Yeah, excuse me, Hiba, I think you are muted. So could you please go through the two remaining questions, all of them together?
Mm-hmm.
Yeah.
Sure. I think that's also a good segue into the next question. So always in the spirit of collaboration and sharing best practices, our audience is very curious to know, based on the specific experience of each of our panelists, what would you say are the specific policy incentives that have proven to be most effective in attracting pharmaceutical FDIs to your countries? So the question is about the specific policy incentives that have proven to be most effective.
And Hiba, just this, also the second question, so that we have both of them under Radha, and then we split.
Yes. The final question, and this is a question based on the dedicated pharmaceutical SEZ in Ethiopia called Kilinto. The representatives of the Kilinto SEZ would like to know how can SEZs position themselves to attract and anchor pharmaceutical tenants or manufacturers. So it's in complementary to the first question, what are the policies to attract pharmaceutical tenants and anchor them? So meaning keep them within the zones for a really long time.
Okay, maybe I can just give it a go.
Can I go first?
Yeah, of course.
So in Kenya, one of the biggest attraction has been the cost of power, and particularly having one of our zone close to where power is generated, and a significant percentage of Kenya's power come from geothermal sources. So a zone called Naivasha has created a lot of attraction because of two reasons. One, and the cost of power is low, and number two, the fact that it's green and things such as steam,
Dr. Kenneth, we lost
steam
you.
which may be necessary alone has been one of the biggest attraction. Number two, and then anchor tenant. I think the idea of anchor tenant is actually very good. If we could have a big pharmaceutical and then others coming in, either in form of having a supply arrangement, that would be perfect and it would be nice. I know the person asking the question is from Ethiopia, but it would be nice to see what they have done. Certainly in Kenya, we've been actually looking for an anchor tenant who then everyone else can be located around them for purposes of supply arrangement. We've not succeeded yet, but we are looking forward.
Thank you so much, Doctor. So you've mentioned access to green energy as a good policy incentive, and also facilitates in supply chains and procurement for pharmaceutical tenants, which is also an interesting point. Bruno, the floor is yours.
No, I just wanted to say that we have done a bit of, in the other report, in the twin report that I was mentioning before, a bit of a screening of the incentives that are normally used to attract investment in pharmaceutical manufacturing. There are two or three things that come out. So very briefly, the first one is that all countries use a lot of incentives to attract pharmaceutical manufacturing. That shows that it's a priority for most of the countries. That they are not very differentiated across countries, and that could be a problem in the sense that in theory they should, because countries are very different from each other. And they can generally be classified. I was mentioning it before in two big classes. One is producing facilitating incentive, which are the fiscal incentives that we were talking before, tax holidays and discounts, and the other one are the market shaping incentives that the government provides because it favors basically local producer in the purchasing of medicine relative to imports. So these are the incentives that are normally used, and they prove to be relatively effective in boosting local production.
And I also want to add my voice to this by saying that one of the policies that Ghana government is currently doing to attract more investors in the area of this pharmaceutical manufacturing is that there's this customized incentive package to these companies. When it comes to free zone scheme in Ghana, we don't have any specific or customized incentive package for manufacturers when it comes to pharmaceuticals. But the current government has now customized a very lucrative, very attractive and competitive incentive package for pharmaceutical manufacturing companies. This is one thing that we are doing in Ghana currently to attract pharmaceutical companies into manufacturing in Ghana.
Okay, thank you so much, Dr. Mary. Would anyone else like to add anything to the conversation? Ricardo, Rada?
Yes, thank you so much. It's been really a very insightful discussion and really valuable. Everybody is adding many perspectives. But let me just end with this. But let me not go to the basics. We know that now SEZs is an important perhaps tool that we need to explore. We need to look at where the gaps are in the existing SEZs as to cater for pharma. And let me take this platform of Bruno here to really ask Kenya, Ghana, and Ethiopia, of course, and Angola to please share with us what you have done, information about the companies there, about, and like we said, about and the gaps. I think Bruno and Hiba can share the AFDB's contacts. This is one. But secondly, in addition to what we are talking about, okay, this is going to be a great way of solving these issues of regionalization, of harmonization, and so on and so forth. Let us not forget that we will still have these inherent issues that most of the manufacturers that we are meeting are facing. The issue of access to affordable long-term finance, right? And this is where GFIs like the AFDB are working together to provide the sort of innovative financing and the blended financing to support the smaller companies to the larger ones, providing technical assistance or the very big debt tickets, for instance. So this the issue of the finance. But then for us, it is very important to when we screen the projects, we want to see viable projects. We want to see commercially viable projects and bankable projects. And this takes us back to the issue of the market shaping. It takes us to the issue of tech transfer and partnerships and so on. So these are issues that even if you have the SE zone, if you don't have these factors in place, okay, there will be issues. The second matter is attracting partners, because at times tech transfer happens at a very slow pace. It is very costly, for the local manufacturers, and normally you feel like there is some form of hesitancy, from big pharma to transfer the technology and so on. And this is much needed now because there is a shift now that we can see in at least in our pipeline, in the needs, definitely in Africa and all of that is now more for more modern type of medicines. We're looking at biosimilars, biologicals, the things that cure NCDs. So let us keep these things in mind, because SEZs are coming to resolve issues of clustering, issues of infrastructure, issues of value chains, but then the other issues need also to be addressed at the same time. Thank you so much.
No. Thank you so much, Ms. Rada. I think we'll finish with the Q&A session on this note. Thank you all so much for your participation. Over to Diane for the closing remarks. I believe she has also a special segment to share with us.
Yeah, thank you so much, Hiba, and many thanks to all the panelists for addressing the questions. So there is one key element which was not really discussed during this webinar. This is the IFCFTA. And I believe in the coming weeks, we can organize a full session discussing on the role of IFCFTA in promoting pharmaceutical sector within the special economic zones. But before we close, I would like to invite my colleague, Regina, to talk a little bit about the IFCFTA. So Regina, over to you. You have only 3 minutes because we are running out of time. Regina, can you hear me?
Yes, Diana. Thank you so much, Diana. I'm not going to take the lyrics, just to basically to say that, AFCFTA has been providing a training opportunity in the SEZ, and UNCTAD, ALDC Division for Africa for Least Developed Countries and Special Programs, has actually been closely involved along with the AEZO in the negotiation process of the AFCFTA, which has resulted in the inclusion of products, manufactured in the SEZ to benefit preferential tariffs under the AFCFTA. Building on these things, and in order, for pharmaceutical companies to benefit, from the AFCFTA preferential tariffs for pharmacy, the pharmaceutical company has to abide by two key elements, two key steps. It's like first is to verify the tariff treatment, or for their specific products, and this can be found under the AFCFTA Secretariat. and also the second AFF secretariat. And also they can also take advantage of the guided trade initiatives. The second part is the rules of origin, you know, where in these there are three alternatives with the rules of origin. You have the CTH, you know, and then the maximum of the venom of 60%, the value of non-originating material, and then we have the chemical reaction. Under this chemical reaction, that the products, you know, that these products, you know, they must undergo substantial chemical transformation. That is the synthesis, purification, and mixing, you know. So it's like, for example, if you have a firm in South African company that's synthesizing aspirin, you know, from base chemical, this will be considered that it meets the chemical transformation criteria, even if the raw materials were imported, you know. So in view of this, given that, you know, we don't really have much of a time, you know, and as we are, and this is more of a technical aspect of it, and the issue is somewhat complex and it cannot be addressed, you know, in this 3 minutes. So we have already discussed with our colleague, you know, with Dan, the office, you know, that, you know, we are ready, the ALDC division, the division for Africa, ready to develop a multi-lot made presentation to explore for the pharmaceutical industry to be able to explore the benefits of the AFCFTA within the various industrial sectors. Thank you so much, you know, for the things. I'll stop there. Bye.
Thank you so much, Regina, for summarizing the presentation. I know you have a very big presentation, and we will find a time to go through the whole presentation. So we are now coming to the end of our webinar. Let me first of all thank AEZO for co-organizing this webinar with UNCTAD. And thank you so much to you, Bruno, for the presentation, as well as for our panelists, Mrs. Mary Awusi, Gada Abuzaid, and Kenneth, and as well as Ricardo. So thank you so much for sharing your insight. It was very useful, and I'm very happy to see more than 132 participants who joined the webinar. So it shows how this is really a very interesting topic, and especially now when we are talking about the AFCFTA, when we are talking about developing the regional value chains. So as highlighted through the discussions and presentation today, advancing pharmaceutical manufacturing in Africa holds immense potential across all the dimensions, which means in the economic development, developing the health sector on the continent. And it's really an important area and the subject, especially when we are thinking about creating jobs, promoting export, and promoting the intra-Africa trade. So, however, the development of a robust pharmaceutical base in Africa, it still have some challenges, which was mentioned by many of you, the panelists. But this is not the end, it's just the beginning of this type of discussions. And as I mentioned, we shall organize another session in the coming weeks, trying to explore more. So as I conclude, today's webinar reaffirmed the strategic importance of pharmaceutical manufacturing in Africa development agenda and the central role the special economic zone can play toward achieving the development in general on the continent. So, ladies and gentlemen, thank you really so much for joining this webinar. We shall reconnect again in the coming weeks. And once again, thank you so much to AEZO for bringing together all their members who are on this call. So thank you. Have a very nice evening for those who are almost in the evening. Thank you. Bye-bye.
Thank you for having us.
Very much. Thank you for the invitation. Great webinar. Bye-bye.
Thank you. Bye-bye.